Been my very objective. I know that, like in my case as a nurse, I've always wanted to help, but in some other ways, being a teacher and doing this, informing you all of this opportunity. Today, I will show you how to perform an administration of inhaled medication. So the patient is in a hospital setting. All the equipment I need is provided, and the date is today, and the time is 2 in the afternoon. Please administer the medication using the prescription below. So this prescription chart is for Andy Smith, 1 Coombe Park. Date of birth is April 2, 1999. MRN 123879. There are no known allergies. Drug name is salbutamol. Drug supplied as 100 microgram per inhalation. The dose is 200 microgram. The route is inhalation. The frequency is QDS. This is signed by Dr. David Watson today. This is a valid, legible, and complete prescription, and it is due my time. I'm happy to give this medication. But first, let me begin this station with the 7 steps of hand hygiene. I've already washed my hands with soap and water, and I will just carry on with this procedure using the hand rub. 1, 2, 3, 4, 5, 6, 7. I'll let my hands dry. Let me now prepare the materials. I will wear a visibly clean apron. I have here a tray that's already been cleaned with soap and water for the past 24 hours. But I'm still happy to clean it with the clinical wipes. Let me just wear my gloves from a box that's dry, intact, and in date. We'll be using this clinical wipes that's dry, intact, and in date. 1. Clean this tray from farthest to nearest using an S motion, including the sides as well as the bottom, and I'll allow it to dry. I'll throw this in the clinical waste bin. Now, the materials we need for this procedure is, first, we need a spacer. This spacer should be a single patient use and should be used within 1 year. It should be clean, it should be intact with no cracks. We also will need the medication. So let me just compare that with the prescription. So this medication is Salamol, 100 micrograms, pressurized inhalation suspension. It is the same as the prescription, and I will be giving the patient 2 puffs as we are required to give 200 micrograms. The expiry date is February 2022, so I'm still happy to use this medication. I made sure to adhere to the 5 drug rights, and I have here the BNF readily available for reference. So I already now have the materials ready for me to give this inhalation to the patient. Assuming that scene safety and privacy have been ensured, identity and allergy have been checked, pain and comfort have been addressed, procedure has been explained and consult has been taken, and I'm happy to go back to my patient. So, hi Andy, I'm back. I already have the medication, the inhalation that you're supposed to have at this hour. Are you still happy to take it?
Yes.
All right, so Andy,
First things first.
I'd just like to confirm that I'm speaking to the right patient. Can you tell me your full name and your date of birth, please?
Andy Smith, the 2nd of the 4th, 1999.
I can see that it's well documented in here. It's the same information. The MRN is 1238879. Do you have any allergies to food, medication, latex, or any dressing?
No.
It's also well documented in here that you don't have any allergies. So, right now, Andy, I'd like to know, have you had this medication before?
Yes, I think so.
All right, good. Now, I'd also just like to give you the instruction on how to properly do it. Is that okay?
Yes.
All right, so just to set your expectations, this medication is only for 100 micrograms per inhalation, and you're required to have 200 micrograms. So we would need to deliver 2 puffs. Is that all right?
Yes.
So this is basically just to help you with your breathing. All right?
Mm-hmm.
So common side effect really is just you may or may not experience cold and clammy skin. If you do so experience, just let me know, okay?
All right.
All right. So I will just explain the process on how you administer this medication. So first things first, you have here the inhalation. So you just have to shake it for 2 to 5 seconds. Attach it to the spacer. Open the mouthpiece. And then you just have to hold it horizontally in front of you. And then you just have to make sure that your feet are flat on the floor. You're sitting upright and your neck is slightly tilted back. So you actually can do it either sitting or standing. But for now, I think it's more convenient for you to just do it sitting down. Are you all right with that?
Yes.
Okay, so I just need for you to hold it in front of you and then just breathe normally. Upon exhalation, I need for you to grasp the mouthpiece with your teeth, seal it with your lips, and then depress the canister. And then you just have to breathe in and out, in and out, in, and then take out the spacer, and then breathe through your pursed lips. Is that clear?
Yes.
All right, so let's now do it. So I now have here your spacer. I need for you to hold it horizontally, and then I need for you to again keep your feet flat on the floor, sit upright with your neck slightly tilted back, then just breathe normally, and then upon exhalation, I need for you to grasp the mouthpiece with your teeth, seal it with your lips, depress the canister. I need for you to breathe in and out, in and out, in, and then I need for you to take off the mouthpiece so you can exhale through your pursed lips. All right?
Okay.
Done. Okay, so just take a rest. I will just shake the medication for around 2 to 5 seconds. All right. Now I'll insert it to the spacer, and then we will now do the second puff. Are you still happy to proceed?
Yes.
All right, so here, I'd like for you to just make sure you keep your feet flat on the floor, sit upright, neck slightly tilted back. I need for you to breathe normally. Upon exhalation, I need for you to grasp the mouthpiece with your teeth, seal it with your lips, and then I need for you to depress the canister, and then I need for you to inhale, and then exhale, inhale, exhale, inhale, and before exhaling, just take out the mouthpiece and then breathe out through upper lips. All right?
Okay.
We're done. So thank you so much. You've already had your inhalation for today. Now, Andy, I will just document that you've already had your medication. So I'll affix my signature and the date today and then the time. And now I will just discard everything to the clinical waste bin. I will make sure that this tray is clean, ready for the next use. I will make sure that this medication is appropriately and securely locked in a cupboard. And then this one also should be cleaned and then stored appropriately. So So Andy, you've already had your medication. Is there anything else that you want me to assist you with?
No, I'm okay.
Alright, so I'll be back around 30 minutes just to check the efficacy of the medication. Meanwhile, if you need assistance, here's the call bell. Just press the orange button. I or my colleague will come to help you. Is that alright?
Alright.
Okay, so would you like me to open the curtains?
Sure.
Let me just open the curtains. Let me end this station, the 7 steps of hand hygiene. Let my hands dry.